Okay, so it's now my pleasure to introduce our speaker. The speaker is Nonkululeko Shibula, is a bereavement care doula and advocate for respectful, culturally grounded care for families experiencing loss. She is the founder of a South African nonprofit supporting women during childbirth and bereavement and also serves on the board of directors of the International Stillbirth Alliance. And through both personal and professional dedication, she works to break the silence around baby loss and provide pathway for healing. In this session, Nonkululeko will highlight the role of midwives in providing culturally sensitive support, how midwives bridge family, community, and cultural systems, the importance of integrating the voice of bereavement parents, and stories and case study this model compassionate collaborative care. And now, please join me in warmly welcoming Nonkululeko Shibula. The time is yours.
Thank you so much, Rizka. Thank you so much for the amazing introduction. My name is Nonkululeko Shibula, and I'm a bereavement care doula, parent voice advocate, a board member of the International Stillbirth Alliance, and also I am a bereaved parent who lost a baby through stillbirth. That was 14 years ago from South Africa. Thank you so much for having me. So I'm going to begin my presentation. Next slide. Thank you so much. Yes, next slide, please. Thank you. So bereavement care is the intentional compassion supports given to individuals and families after loss of a loved one. It goes beyond medical procedures. It's compassion in action. It's especially important in perinatal and neonatal loss, which is often invisible in our African settings. There is often no language or ritual available for this type of grief. It's about walking with families through some of the darkest hours of their lives, not to fix their grief, but to be a witness to the grief with tenderness and respect. Next slide, please. It also involves, Rizka, please go back to the other slide, second slide. Thank you. It also involves creating space for parents to meet, hold, and remember their babies, however briefly they were here, supporting healthcare systems and teams to respond with empathy, clarity, and presence. It is advocating for systems that recognize loss and uphold dignity in life and in death. We need systems that validate the loss memory making tools and compassionate communication. And I always emphasize culturally sensitive care that includes supports such as naming babies, allowing mothers to hold their own babies, and creating keepsakes. So it's not an add-on to medical care, it is essential care. It says to families that your loss matters, your baby matters, and you're not alone. Next slide, please. When the unthinkable happens, my work is strongly inspired by my personal story, where I had a stillbirth in a public hospital, and I was 18 years old when it happened. So I did not receive the care that I needed. Just to cut the story short, and there was a lot of silence in the room. Yes, I was isolated. I was in an isolation room, but that also caused me not to receive any proper medical attention, such as pain medication, something simple as pain medication, and checkups and proper communication. So that was not provided to me, and a whole lot of miscommunication and a whole lot of silence, confusion, lack of guidance. No one had shown my healthcare givers how to take care of mothers who have lost their babies. So this is the training and collaboration that we must bring. And I remember looking around, searching for someone to tell me what to do. What does this mean? But everyone seemed unsure or awkward, emotionally distant. And I understand now that it's not that they didn't care, it's that no one had ever shown them how to. Next slide, please. So there are gaps working with healthcare providers. Since I started supporting moms, I have paid witness to gaps that were happening in the healthcare system. And I started taking notes and highlighting the gaps in addressing such problems. So there's a huge disconnection between medical task and emotional support. And we need to work together to build trust into every encounter. Lack of specialized training in perinatal loss, poor communication and emotional disconnect from providers, hospital environments that do not support healing, inconsistent access to memory making tools and rituals, and minimal post-discharge support. Yes, they would advise that you need to come back at any time, at any given time. Our doors are always open. But each time a mom will come back, they do not remember her, they don't recognize her. So now she needs to explain all over again why she's back and what assistance that she needs, and maybe come back when the doctor is available or set up an appointment and come back for another appointment. So it's such gaps that we need to actually build a bridge and address as well. Thank you. Next slide, please. So a message that I would have for healthcare providers. First of all, midwives are powerful agents of change by leading with compassion. I have witnessed care and compassion with the midwives that I have worked with, midwives that have consulted in terms of caring for families that have lost their babies. So they have gone an extra mile to their work to actually try and address the gaps and make a difference in their community, because midwives are also community workers as well. So the way you speak, the time you take, the space you hold, it stays with the families forever. You are part of the memories that, or part of the story that the family will then take home, the story that will forever be told by the families. You might not remember every patient, but they will always remember you. You are part of a sacred moment in a family's story, and your presence can either be part of the trauma or part of the healing. And that's why I invite you all to continue with the dialogue, partnerships, as well as training. Next slide, please. So what I hope for is a world where every loss is honored, where care doesn't end when the heartbeat does, where hospitals speak the language of compassion fluently, and change starts with one story and courage to tell the story. Next slide, please. Thank you. I will then take questions.
Okay, thank you so much, Ms. Nonkululeko, for your heartfelt and powerful message. You have reminded us that presence, compassion, and intentional care are not luxuries but necessities, especially in the fragile moments of perinatal loss. To begin our Q&A session, I would like to ask you maybe the first question for me. Is it very interesting presentation, and I want to ask the question. Many healthcare providers genuinely want to support families experiencing loss but often feel unprepared or emotionally overwhelmed. in your experience, what is the first step a midwife or nurse maybe can take to begin offering meaningful bereavement care, even in a busy or under-resourced setting? Thank you.
Thank you so much for your question, Rizka. So, burnout is, I think, a huge thing that happens when you're overly compassionate and when you carry the burden, or you're one of the few midwives who actually take it upon themselves to actually do something different. But if the work or the load is shared and it's a conveyor belt that is moving smoothly, normalize part of the process. If I'm saying normalize, I mean we also include self-care in the process and debriefing in the process, which is aftercare for yourself as a healthcare provider or as a midwife as well, after witnessing a loss or after being part of the process. So if we could all share the load or the normalize such settings, then we also leave space for self-care, or we also include self-care in the process, and you also include debriefing sessions in the process. I know one of the midwives that I've worked with in a private hospital, in the morning, they have asked me a few times to come in just after their meeting to have a debriefing session. So that actually helps. And then some might need an extra care and then they were referred, and some might not, might just really need to just let it out, in a safe space. So that's actually part of it. Thank you.
Yes, it's so important. Maybe we can we can move to the Jen comment. Okay, Jen twin sister also lost a daughter 15 years ago. Okay. And healthcare in Scotland was also very poor. You offer personal. What helped you the most accept this devastating loss of your own child?
So at first, I did not accept. I put everything in the box. I packed everything, every emotion, everything that I've felt, everything that I've seen and witnessed on the day. I put it away, and on that week, because my labor was 7 days long. I put everything away and I moved on with my life. And it happened again in the family. And that's when I realized that something needs to be done. I started asking myself questions as to, is there really something that's being done out there for parents, to assist parents who have lost their babies? I started searching. And as I started searching, I started healing as well. My first ever encounter with my reality was one night, and as I cried so much. I have never cried like that before. I cried, and then I realized that I actually need to unpack the box that I've put under my bed, honestly, and just label everything. So I started journaling, and I started reading. I read books. I journaled. I wrote poems to my baby. I wrote letters to my baby, and I even have a drawing. I'm a visual artist also, so I draw. Through my memory, I drew her portraits, and I curated a playlist as well. I also love music, so I curated a playlist, and that's when my healing started. So healing looks different and feels different for each and every one of us. But if we take it upon ourselves to actually do something and actually realize that we are not alone. We have other mothers who are willing to heal, who are willing to hold other mothers' hands while they're healing. So that's how I basically dealt with things. Thank you so much for your question, Jane.
Yes, thank you for the Jen comment and also the Miss Non answer. And I just wondering about you mentioned that your presence can either be part of the trauma or part of the healing. That's such a powerful statement. Could you share an example maybe of what a healing presence looks like in practice, especially for those who may not have formal bereavement training? Maybe you can give the example of the powerful word.
Of course, of course. So, first of all, it is to acknowledge what's happening right now in the room. Yes, you are a medical professional, but having no sense of empathy at all, you're not recognizing what's happening right now, or you just want going to go ahead and do the paperwork, or as per normal, this is required. So you're not paying attention to what's happening in the room. There's a mom, there's a baby that's not breathing, and there's a connection, a memory that needs to be made. And you are part of the memory. So you play a part, you know. So you actually acknowledge the baby, just like how you would acknowledge a live baby. You greet the baby just like how you greet the live baby. You speak to baby just like how you speak to the other babies. And then you give mom um, an option, or you ask mom, would you like to hold your baby? Would you like to take pictures, or what would you like? So let it come from them. You are now a communicative tool between the mom and baby and what's happening in this birthing room right now. So how you do it and how you go about it is very important. Yes, you are a huge part of the story, because whenever I tell my story given a platform, I always speak about the midwife that said, oh, you see what happens when you have a baby at such a young age. That was said to me by a midwife. I'll never forget that. So I tell the story given. And I'm sure that other parents tell the story of what part did the midwife play. The midwife handed me a baby, or the baby was wrapped in such a beautiful blankie, or they gave me such a cute beanie. We also have they made footprints for me. They took their time and went overboard. They did footprints for my baby, and I'm so grateful for that. They gave me a birth certificate for my baby, and I'm very grateful for that. Or they gave me this cute card, and I'm very grateful. So there's a face behind the card, there's a face behind the footprint, and there's a face behind that little picture. There's a face behind that beanie, and that face is you.
Yes, perfect. Thank you, Miss Non. So I would love to hear from one or two participants in the session. You can write the chat in the chat box or feel free to raise your hand. What part of the presentation touched you most? Maybe you can write in the chat. And was there a moment or a phrase that stayed with you? You can raise your hand, you can speak directly, or you can write in the chat box. Or maybe if you want ask the questions, you can raise your hand or write in the chat box. Oh, this is in the chat, Michelle just asked the question. I really felt this while working with HIV positive pregnant women and mothers. Their children died very often, and when they would call me about it, I did not have any preparation for how to respond. And I was also getting this call 7 days for week, and my supervisor didn't have an understanding how to support me, so I could support a woman in the community. It's an area that is so overlooked. Maybe you can share your experience, Miss Non, about that.
Yes, I agree as well with the statement. That's a very strong statement. Thank you for pointing that out. Um, I've recently started working with palliative care network in my community. So it's end of life for perinatal, for in the perinatal space, in the NICU, stillbirth as well. So just end of life in general. And it's a huge struggle because with everything else that it is involved, the medication, the care that needs to be given and the guidance that's given, nobody addresses what happens when a life ends. What ends when a life ends? Because not every life comes to a healing, lives with us. But I think that's a taboo that we are slowly trying to address. What happens and what is it that we need to do when life ends. So as part of the trainings that we get ourselves involved with, we need to raise such issues and such concerns in our spaces.
Yes, it's wonderful. Yeah, also we have a comment from Agnes. The first comment, the very personal account by Nonkululeko, and also the second comment, the practices that do not negatively impact further on a woman's experience. There is the blanket speaking to the baby footprints, the kindness of the midwife, and also maybe midwife don't judge the statement of the mothers, but also supporting each other. It's also important, Miss Nonku. Yes, any comment of this statement, Miss Nonku?
Yes. Thank you so much for also pointing that out. Last year when I went to Sri Lanka, there was a midwife who did a presentation and it was called Rosebud. So in India, they call it Rosebud, and it's a term or a keyword that they use when there has been a loss in the neonatal ward. So when someone addresses or says there's been a rosebud, they all know what to do. They all know how to react. Someone needs to get this. Someone needs to get the memory box. Someone needs to start capturing that, and they all know how to move. So I always emphasize that each and every setting, we know our environments, we understand the people that we work with, and we need to find a healthy workflow that also includes bereavement care in it. So that includes the memory making, that includes a normal procedure on a normal day, that there might be a loss, and what happens, this is what we do. And when it happens, this is what we pull out. Yeah. So thank you.
Yes, thank you. Okay, any question for all participants again? Maybe you can share experience also, or you can ask the question or comment the chat box, or you can raise your hand and directly you can speak with our speaker in the session. Very interesting, Nonku. I hope we can share about the practice in in the other countries. Maybe in Indonesia we have more cultural, but we should have the good communication around the midwife. And also in the patients, like a mother and patients in family, maybe in the practice is so important.
Thank you. And I have Yana in Indonesia who's doing such amazing work for moms who have lost babies. So I'll share the contacts with you if you are interested. She's doing
Yeah.
amazing work. Okay.
Yes, thank you, thank you. Okay, all participants, if you don't have any question, it's okay. You can comment in the chat box, or you can say thank you for our speakers in the session. And now I would like to invite you all of you to reflect, not only as a professional, but as a human. What resonate with you? What challenge your thinking and how might this shape the way you work alongside grieving families in your own context? Maybe you can share the own experience or your own thought in the chat box. Okay. You can reflect of your practice in the daily activity in your patients. Yes, thank you. Thank you, Michelle, Lydia, and also all the participants have active comment and reacted. Okay, thank you so much, Miss Nonku, and for sharing your insight and your advocacy. And to all the midwives present today, thank you for your care, resilience, and presence in life's most sacred transition.